Okay. Um, so here we go. We're going to talk about chapter one, which is Introduction to Assessment. And we'll start it off by defining health, which is the complete physical, mental, and social well-being of the overall patient, not just the absence of disease. So that's what we're dealing with. That's our definition. Health assessments is this huge monster, and the way I look at it is kind of just like three parts. We have the health history, all right. You have the nursing intervention, and you have the physical assessment so far. And of course, we'll expand as we go, but this is where we're going to start off at. You do have some tools. I'm going to just move the screen a little bit. You have some tools to work with. You have your ADPI, um, you're assessing the patient, developing plan, or I'm sorry, assessing the patient, diagnosing, making plans, implementing, and evaluating. And of course, that implementation and evaluation will continue to occur. All right. Six facets, which will be here throughout the text, so that is a way of identifying the patient, making sure that you're encompassing all components of the patient, and maybe refer to that in a lot of different ways. Old part, basically, how can we better define an issue? CAGE is something that we're going to use later on for alcoholics or addiction, and FIFE is trying to identify patient feelings, and we'll talk about that later as well. All right, so the health assessment, back to here. Health assessment is a nurse's foundation. This is where we are able to influence the patient, gain trust, how we can help people not only with actual issues, but health promotion, and they refer a lot to health promotion in this. Assessment is our bread and butter. Our assessment is where we are going to figure out, hey, this is the overall patient. These are the components of this patient, because we're not just one-sided. We're not even three-sided. We have tons of different elements. But the easiest way to break it down into something that we could talk about is looking at those six facets. So we'll go into that. So from the health assessment, we're able to figure out the status of the overall patient. So what is wrong with the patient, or maybe it's just that they're coming in for a physical and we're trying to do health promotion. Right? Health promotion again is huge. Remember, it's about the individual patient, and trying to ask some questions. Right? So status, how can we improve? Looking at improvements here. All right. The health assessment, like I said, is going to be a continuous process, and we'll expand on this part in a little bit. So ADPI, let's just refresh about ADPI. You have A for assess, you're assessing your patient overall, and that's where you're going to get information, you're going to do the physical, you're going to get all that stuff right there. D, diagnose. Now remember, for nursing diagnosis is not that we're diagnosing a medical condition. We are diagnosing human response. So the doctor is going to diagnose you with hepatitis C. The nurse is going to diagnose you with they have impaired social relationships now, and here's what we can do to treat it. All right. Plan. Plans always include the patient. So when you're doing the planning process, make sure that you're including the patient in that, because they are active participants. So interventions, you're going to implement your interventions. So start implementing your plans. Whatever I decide I'm going to do, I'm implementing, and I'm going to continually check up on that so that we can make sure that we get that patient in the best state of health. And then first evaluate, and that's proof that one, the patient's getting better. Two, are we hitting our goals? And three, it shows the importance of nursing. All right, so that's ADPI. Six facets, and see if I can find this white space right here. All right, I was kind of looking at it like this. Specs DS. All right, so specs DS. If you can figure out a different way to spell that out, that works too. All right, so I'll start with the S's. We have social, and we have spiritual. And of course, I abbreviate everything, but we have physical, emotional, developmental. And cultural. Okay, so social. What's our social network like? We need to encompass all aspects of the patient. And again, there's a lot of aspects to people, but these are a way to break it down a little bit better. So social is, do they have social foundation? And physical, what are their physical limitations? What are their physical abilities? What's ailing them? Or what's good? Emotional, how are they dealing with stress? How are they dealing with sleep? How are they dealing with nursing school? Cultural, so what is their culture? Does it define them? Do they have that cultural support? What type of, and again, some cultures, in their relationship to medicine, does that differ? Developmental, that really got me for a loop on the developmental, because when you think developmental tasks almost. But here they're talking about not just like an education aspect of it, but your values. Like, how are you developed as a person overall? Values, morals, and then spiritual. Remember, this doesn't have to necessarily be religion, Christian, Muslim, whatever the case may be. This can be something where we just feel like there is a higher purpose, there is a purpose to my life, the world has meaning, things like that. So these are the 6 aspects, 6 facets of a person. And the way I kind of remembered it was this, other than this, but yes. So the way I remember it is going back to our one of the initial videos where we had talked about a lady that was an immigrant and was on a electric scooter. And we're going to use her again. So unfortunately, she is taking the brunt of all the negativity. Alright, so here's our person. And unfortunately, she doesn't have very much mobility, so she's on an electric scooter. Alright, so here we go, applying all of our facets of this person. Alright, we're going to have to find somebody else to click on here soon. Alright, but, so here she is, a horrible player, but here she is. So, social, she probably doesn't have a whole lot of friends. She can't get out much, so it's hard for her to make friends. She's lacking that social element. She's emotional, and that can relate to maybe her physical or the lack of her social connections. Alright, so she's emotional. She could just as well be angry or happy, but you have your social, you have your emotional, physical. She probably has high blood pressure. I would not doubt that. High blood pressure, lack of mobility, and cultural, like we had talked about before, she was an immigrant, so she might not have the cultural support that she feels like she needs, and she might have different views about medicine. So that's important to keep in mind too. Developmental, while she might be legitimately, have educational delays, there's also, does she have values? And maybe she doesn't have any values. Maybe because she's in a completely new place, the values aren't in line anymore. And then spiritual, does she have either meaning or Christian, or does she have some type of religion? So maybe she doesn't have that either. So it's not only does she not have that, she doesn't have a church or meaning. And again, it doesn't have to relate to a specific religion. So she's lacking meaning in her life. Alright, so there's our poor lady in Walmart who's constantly getting picked on. Alright, so those are the 6 facets. And they're kind of used throughout to help make sure that you're incorporating all the person, because the person's not just one-dimensional. Old carts. Let's get rid of our Walmart lady. Others. Alright, old cart. This is just an acronym that they are using to help define and specify patient complaints. Although it's kind of used throughout the text in different ways. Alright, old cart. Onset. When did it start? Alright, so I have pain in my right hand side, and it started 2 days ago. Location. Well, I just said it was my right hand side, but can you get more specific? Maybe it's my anterior lumbar. or anterior opening. Anyways, again, we're specifying. So that's onset, location, duration. How long does it last? If like maybe my pain is only 5 minutes at a time. We need to know that because that's the difference between one diagnosis and a completely other set of problems. Characterization. Can you characterize it or describe it? That's where we go. Can you tell me more? Or is it like this, this, or this, or this? Giving multiple different answers or options to choose from. Associated manifestations. So, when my right side hurts, my left eyeball goes numb. Alright, associated manifestations. Associated, my, what did I say, left or right eyeball. My eyeball goes numb. Eyeball. That's a technical term, by the way. Alright. Relieving factors. Alright, so when I get this, I'm able to relieve it by sitting down maybe, or by resting, or whatever the case may be in treatment. So far, I've taken 1,500 milligrams of Motrin daily for your NSAIDs. Alright, so onset, alright, when did it start, location, where is it, and again, try and get specific duration, how long does it last, characterize it, associated issues, so when this particular pain starts, so does this, or when this happens, I lose my balance, or what else is occurring. We're trying to make connections. Relieving, what relieves the pain, alright, and then treatment, what treatment have you done so far, and that's important because if we can rule out something, or maybe somebody takes way too much medication, then I would say, okay, well, you've had tons of this NSAID, so let's not use that anymore because we're getting to the point where you're overloading your system, right? So that's why old cart's important. Alright, the other parts that we need to look at for chapter 1. Chapter 1, let's get rid of old part now. This is pretty good here, and we'll do it right now. Alright, chapter 1 is just your introduction, so the other things we'll hit on more as we go through, but healthy people is our other big thing. Healthy people, basically, healthy people 2020, alright, this is every 10 years, and it establishes goals, risks, diseases that are of importance right now or that are affecting a larger population, objectives, and you've got to remember this is a grand, huge scale. This is not just 1 or 2 people, it's not just a town, this is everyone we're talking about. So they're talking about a much larger scale, but some of the things that they really hit on are everybody having access to healthcare, decreasing health disparities, decreasing cardiovascular risk, setting those goals, and then diseases of importance. Maybe they've seen an increase in, I don't know, cardiovascular disease, so they want to really watch out for that. And goals might be health promotion, like get everybody doing 30 minutes of exercise most days a week. Alright, so that's Healthy People 2020. And of course, it's going to change, in the next 10 years, it'll be another one. And they'll reassess as they go through. Alright, so that's pretty much where we'll start off with that. We'll go more into health history and of course physical and view. But that's just a good health assessment, and we'll continue to build on that one, okay? Alright.